Basis of the 2008 mortality rate data, 2,200 Americans die daily of cardiovascular disease. That's an average of about 1 in every 39 seconds. According to AmericanHeartAssociation.org, mortality rate statistics of the 2012 update. Early recognition can decrease mortality associated with cardiovascular disease, heart attack, or acute MI. Also AMI. You have a heart, so everyone else is at risk. Everyone who has one is. Symptoms may present a little differently depending on who you are, but for the most part, they're a general aspect. As a paramedic student, I am required to be certified in advanced cardiac life support and very well versed on recognizing these symptoms. There are many different symptoms, and I'm just going to tell you the most important, like the predominant ones in men, predominant ones in women, and how seeking medical attention during early presentation of these symptoms can decrease your risk of death. The more obvious symptoms of a heart attack usually present more predominantly in men. A crushing chest discomfort that presents itself during activity or work or anything that doesn't resolve with rest after about 15 minutes is the most prominent sign of some sort of blockage or lack of oxygen to an area of the heart. The crushing chest discomfort usually causes some sort of shortness of breath due to the chest cavity pain, I guess. Your body has many ways of telling you that there's something wrong. One of these is your central nervous system, sympathetic nervous system will release adrenaline to constrict the vessels in the outermost vessels to push more blood to the heart and into the affected area. This adrenaline dump will give you kind of a feeling of anxiousness and sometimes a feeling of impending doom. Although the previous symptoms can present in anyone, they tend to present a little differently in women. Sudden onset of weakness, nausea, vomiting can occur due to the adrenaline dump. The sympathetic nervous system is also known as your fight or flight response. So in order for you to be lighter to fight or flight, it tends to empty out your bowels or stomach contents. And women also usually present with back, neck, and jaw discomfort without any actual chest pain, which causes us to be clinically harder to diagnose. They also get a general feeling of just overall ickiness, which can also present without chest discomfort, and they also usually have some sort of sleep disturbances. Recognition and seeking help from medical professionals when these symptoms first occur increases your chance of survival. It's better to seek medical attention and be told that you're not having a heart attack rather than have one and not know. ACI.com seconds count states, your heart is a muscle. Blood carries vital oxygen and nutrients to the heart muscle, and without blood, the heart muscle begins to die. That's why every second counts. When you obtain the proper medical attention early, there's a better chance for a full recovery without long-term damage. There's a 90-minute window from the time you walk in to the time you are in the cardiac cath lab receiving your treatment. I hope I've been able to shed some light on a very important matter and save maybe a couple lives or quality of life. Informing you of the symptoms of men, women, and how this all works is going to be part of my career for the rest of my life. And so this isn't going to be the first time I'm having to talk about this. Recognition and seeking help will decrease yearly mortality rates due to cardiovascular disease and MI. Are you going to let ignorance and pride make you or your loved ones a statistic, or would you rather have a long, healthy life with your family?